Imagine lying on a stone slab, fully conscious, as a Bronze Age surgeon saws through your skull with a flint blade. No painkillers, no anesthesia, just 4 strong men holding you down while you scream. This actually happened, thousands of times. And what I'm about to show you in this video will make you thankful you were born in the 21st century. Because Bronze Age medicine wasn't healing, it was survival of the strongest. We're talking about an era when drilling holes in your head was considered routine medical care, when surgeons would cut open your chest cavity with bronze knives while you were wide awake, when the cure for a headache involved literally splitting your skull open and scraping out pieces of bone. Archaeological evidence from sites across Egypt, Mesopotamia, and the Mediterranean reveals medical practices so brutal they make medieval torture look merciful. We have actual Bronze Age skulls with perfect surgical holes, healed bone fractures that were set without any pain relief, and medical papyri describing procedures that will haunt your nightmares. But here's the truly terrifying part. Many of these patients actually survived, which means they endured unimaginable agony and lived to tell about it. In this video, I'm going to walk you through the most horrifying medical procedures of the Bronze Age, backed by real archaeological evidence and ancient texts. And I promise you, by the end of this video, you'll never complain about having to take your medicine again. Welcome to Life Before Iron, where we dive deep into the brutal realities of life before modern civilization. I'm your host, and every week we explore the shocking truths about how our ancestors actually lived, loved, and died. If you're fascinated by the darker side of human history, make sure to hit that subscribe button and the notification bell, because we're just getting started with the nightmares our ancestors called everyday life. Let's start with the most mind-bending procedure of the Bronze Age, literally. Trepanation, the practice of drilling holes in living skulls, was performed across virtually every Bronze Age civilization. And we're not talking about a few isolated cases. Archaeologists have found thousands of trepaned skulls dating back 4,000 years. The Edwin Smith Papyrus, an Egyptian medical text from around 1600 BC, describes the procedure in chilling detail. The surgeon would first shave the patient's head, and here's where it gets terrifying. They had to keep the patient conscious throughout the entire procedure because they needed to monitor brain function. Picture this. You're lying face down on a limestone table in ancient Egypt. The surgeon, using a bronze drill bit no more sophisticated than a carpenter's tool, begins boring through your skull. The grinding sound of metal on bone fills the temple chamber. There's no anesthesia because it hasn't been invented yet. The best you get is a stick to bite down on and maybe some fermented barley beer to dull the edge. The process took hours. The surgeon had to work slowly, stopping frequently to clear bone dust and blood from the hole. They knew that one wrong move, one slip of the bronze drill, meant instant death. But somehow, incredibly, many patients survived. We know this because their skulls show clear evidence of healing around the surgical holes. But why would anyone submit to this torture? Bronze Age physicians performed trepanation to treat everything from headaches to epilepsy to what they believed was demonic possession. They thought evil spirits lived inside the skull, and the only way to release them was to give them an exit route. Take the case of a Bronze Age woman found in Kazakhstan, designated as burial KK 782 by archaeologists. Her skull shows not 1, not 2, but 5 separate trepanation holes. The bone growth around each opening proves she survived. Imagine enduring skull surgery 5 different times, each one taking hours of excruciating drilling while fully conscious. The final hole was never completed. You can see where the bronze drill broke through the outer layer of skull but stopped halfway through. She died during that 5th surgery, finally succumbing to what she had survived 4 times before. Even more disturbing is a skull found at Jericho dating to 2200 BC. The trepanation hole is perfectly circular, about the size of a modern quarter. But here's what makes your blood run cold. Archaeologists found bronze drill bits still embedded in the skull cavity. The surgeon was apparently working so fast, trying to complete the procedure before the patient died of shock, that the drill bits snapped off inside the brain. Somehow, the patient lived for weeks afterward. We know because the bone shows healing around the metal fragments. And that's just skull surgery. When it comes to broken bones, the Bronze Age had solutions that would make you beg for amputation instead. Fractures in the Bronze Age were a death sentence. Not because they were fatal, but because of how they were treated. Archaeological evidence from Bronze Age burial sites reveals bone-setting techniques that would make a modern orthopedist sick. When someone broke a major bone, Bronze Age healers would pull the limb back into roughly the right position, then immobilize it using wooden splints and linen bandages. Sounds reasonable, right? Here's the nightmare part. They did all of this while the patient was fully conscious and in excruciating pain. A femur fracture, for instance, required the healers to literally pull the thigh bone back into alignment through sheer force. This meant grabbing the person's leg and yanking it until they felt the bone snap back into place. The screaming could reportedly be heard from several houses away. But the real horror came afterward. Bronze Age splints were essentially torture devices. Made from rigid wood and bound with tight leather straps, they couldn't be adjusted as swelling increased. Many patients developed gangrene simply from the splints cutting off circulation. Archaeological evidence from Nubian burial sites shows healed fractures with bone calluses so thick and misshapen that the victims would have been permanently disabled. X-rays of these ancient bones reveal fractures that healed at impossible angles, arms that bent backwards, legs that curved like question marks. But if you think broken bones were bad, just wait until you hear what Bronze Age dentists did to your mouth. Bronze Age dentists had exactly two tools, bronze picks and brute force, and they used both liberally. The Ebers Papyrus, another Egyptian medical text, describes treatments for dental abscesses that sound like medieval torture methods. The standard procedure involved heating a bronze probe over an open flame until it glowed red, then pressing it directly against the infected tooth to burn out the evil. Can you imagine? No numbing agents, no pain relief, just searing hot metal pressed against an already agonizing abscess. The smell of burning flesh mixed with the patient's screams created an atmosphere that witnesses described as hellish. But infected teeth weren't just painful, they were often fatal. Bronze Age people had no understanding of bacteria or infection. When an abscess spread to the bloodstream, as it frequently did, patients would die slow, agonizing deaths from sepsis. Archaeological examination of Bronze Age skulls reveals dental work that defies belief. Some skulls show evidence of teeth being extracted by being literally hammered out with bronze chisels. Others show attempts at crude root canals performed with heated bronze wires. One particularly horrifying find from ancient Mesopotamia shows a skull where the dentist apparently tried to drill out a cavity using a bronze bit. The hole goes completely through the tooth and into the jawbone beneath. The patient somehow survived this butchery. The bone shows signs of healing. But imagine the agony of having your jaw drilled through while fully conscious. And dental torture was nothing compared to what happened when Bronze Age women gave birth. Childbirth in the Bronze Age was a barbaric ordeal that killed mothers and babies in staggering numbers. Without understanding of hygiene, anesthesia, or proper surgical techniques, Bronze Age midwives relied on brute force and superstition. The process began with positioning. Bronze Age women gave birth squatting on special birthing stones, designed to allow gravity to assist delivery. While this sounds logical, the stones were rarely cleaned between uses, turning them into breeding grounds for deadly bacteria. When complications arose, breech births, cord entanglements, or oversized babies, Bronze Age midwives had terrifying solutions. Ancient Mesopotamian tablets describe procedures for turning the child that involved reaching inside the birth canal with bare hands to manually rotate the baby. Without antiseptics or even basic hand washing, this usually introduced fatal infections. For stuck babies, the standard procedure was even more horrifying. Midwives would use bronze hooks to grab the baby and literally pull it free. Archaeological evidence suggests that both mother and child rarely survived these extractions. But perhaps the most disturbing aspect of Bronze Age childbirth was the treatment of complications. When bleeding wouldn't stop, midwives would pack the birth canal with cloth soaked in various substances, honey, animal fat, even human waste, believing these had healing properties. Instead, they usually caused massive infections that killed the mother within days. Speaking of infections, Bronze Age medicine cabinets read like a list of biological warfare agents. Without understanding of how diseases actually worked, Bronze Age physicians prescribed treatments based on sympathetic magic and sheer desperation. For stomach ailments, Egyptian physicians prescribed a mixture that included crocodile, dung, rotting fish, and fermented human urine. The logic was that since crocodiles were powerful predators, their waste would give patients strength to fight illness. Instead, it usually gave them cholera. Mesopotamian healers treated headaches with a concoction that included powdered human skull, believing that bone would strengthen bone. Patients were required to drink this mixture while it was still warm from preparation. Archaeological analysis of Bronze Age remains shows evidence of lead poisoning, likely from these medicinal compounds. For eye infections, Bronze Age doctors would mix honey with ground copper and apply it directly to the eye. While honey does have some antibacterial properties, the copper created chemical burns that often led to permanent blindness. But the most disturbing Bronze Age medications were those used for mental illness. Believing madness was caused by supernatural forces, physicians would prescribe treatments designed to make the patient's body uninhabitable for evil spirits. This included forcing patients to consume poisonous plants, burning herbs directly on their skin, and in extreme cases, deliberate poisoning with mercury compounds. However, if you thought Bronze Age medicine was insane, their surgical procedures were pure nightmare fuel. Major Bronze Age surgeries were endurance contests between patient and physician. The goal wasn't comfort, it was speed. Surgeons knew that unconscious patients didn't survive operations, so they needed to work fast while the patient remained awake. Abdominal surgery was particularly nightmarish. Ancient Egyptian texts describe procedures for removing gallstones that involved cutting through the abdomen with bronze knives while assistants held the patient down. The surgeon would literally reach inside the body cavity, locate the problem organ by feel, and extract stones or growths with bronze forceps. The patient, meanwhile, would be conscious throughout the entire procedure, feeling every cut, every probe, every manipulation of their internal organs. Many patients died not from surgical complications, but from shock caused by the unbearable pain. Eye surgery in the Bronze Age was pure horror. The Ebers Papyrus describes a procedure for removing cataracts that involved inserting a bronze needle directly through the cornea while the patient was held down by 4 assistants. The surgeon would then use the needle to literally push the clouded lens to the back of the eye, hoping to restore partial vision. There was no consideration for sterility. The same bronze needle was used on patient after patient, spreading infections that often led to total blindness or death from sepsis. One particularly disturbing case comes from a Bronze Age tomb in Thebes, where archaeologists found the mummified remains of a court official who had undergone multiple eye surgeries. Both eye sockets show evidence of repeated bronze needle insertions. The man survived these procedures, but the scarring suggests he lived his final years in complete blindness, the bronze needles having destroyed his retinas entirely. Tumor removal, was another exercise in Bronze Age butchery. Surgeons would cut around growths with bronze knives, often removing large chunks of healthy tissue along with the tumor. A skeleton found at Nuzi, an ancient Mesopotamian site, shows evidence of a massive surgical procedure where the entire right side of the ribcage was cut away to remove what was likely a chest tumor. The bone regrowth patterns indicate the patient survived this mutilation for several years, living with a permanently deformed chest cavity. Bronze Age amputations were exercises in controlled butchery. Without anesthesia, surgeons had to work incredibly fast to prevent patients from dying of shock. The standard technique involved using bronze saws to cut through bone, while assistants applied tourniquets made from leather straps and leather restraints to prevent the patient from moving during the procedure. The most horrifying amputation on record comes from a Bronze Age warrior found at Tollense Valley in Germany. His left arm had been completely severed at the shoulder, not in battle, but in a surgical procedure. The cut marks on the bone are too clean and precise to be from combat. What makes this case truly nightmarish is that the amputation was performed while the bone was still green, meaning the man was alive during the procedure. The surgeon had to saw through the humerus, the shoulder blade, and all the surrounding muscle tissue while the patient remained conscious. Somehow, this warrior survived and lived for months afterward, as evidenced by the healed bone tissue. Archaeological evidence from Bronze Age battlefields shows that amputation was surprisingly common. Soldiers who lost limbs in combat were often taken to military surgeons who would clean up the wound by sawing through shattered bone and removing damaged tissue. But the most disturbing discovery comes from a mass grave near ancient Ur, where archaeologists found the remains of at least 12 men who had undergone similar amputations. All had lost their right hands in identical surgical procedures. These weren't battlefield injuries, they were punishments. Bronze Age justice sometimes involved surgical amputation as a form of legal sentence carried out by the same physicians who were supposed to heal. The survival rate for these procedures was less than 50%, but those who lived carried both physical and psychological scars forever. Many Bronze Age amputees show evidence of chronic infections at the amputation sites, suggesting they lived in constant pain for years after their surgeries. But here's what makes all of this even more terrifying than it sounds. Not how many people died, but how many somehow survived. Archaeological evidence shows that Bronze Age populations routinely endured medical procedures that would kill modern patients, even with full anesthesia and surgical support. Bronze Age bones show evidence of multiple major surgeries on single individuals. Some skulls have 3 or 4 trepanation holes, indicating that patients survived the procedure multiple times. Fractured bones show evidence of being rebroken and reset, suggesting that people lived through repeated orthopedic trauma. This wasn't just physical toughness. It was psychological resilience beyond modern comprehension. Bronze Age people accepted that medical treatment meant agony, and they endured it because the alternative was certain death. But survival came at a cost. Bronze Age medical patients lived with constant pain, permanent disabilities, and psychological trauma that would be diagnosed as severe PTSD today. They survived, but they were forever changed by experiences that pushed human endurance to its absolute limits. And here's the final twist that makes this story even more disturbing. Perhaps the most horrifying aspect of Bronze Age medicine wasn't the procedures themselves, but what they revealed about the value of human life. Medical treatment was reserved for the wealthy and powerful. Common people who suffered serious injuries or illnesses were often simply left to die. Archaeological evidence from Bronze Age settlements shows clear disparities in medical care based on social status. Elite burials show evidence of sophisticated surgical procedures and expensive treatments. Common graves show untreated fractures, dental abscesses, and infections that slowly killed their victims. For Bronze Age peasants, a broken leg meant disability, poverty, and eventual death. For Bronze Age kings, The same injury meant expensive surgery, months of recovery, and a return to normal life. The difference was access to physicians willing to inflict the necessary agony to save them. This created a brutal equation. Medical survival required not just physical toughness, but economic resources. Bronze Age medicine wasn't healing. It was a luxury service available only to those who could afford to suffer properly. The next time you complain about getting a flu shot or having blood drawn, remember what we've learned today. Bronze Age people endured skull surgery with bronze drills, bone setting without anesthesia, and dental work that involved red-hot metal probes. They did this not because they were braver than us, but because they had no choice. What's truly remarkable isn't that Bronze Age medicine was brutal, it's that it worked often enough to keep civilizations alive. These horrifying procedures, performed without understanding of anatomy, infection, or pain management, somehow produced enough survivors to allow human societies to grow and prosper. If you enjoyed this journey into medical nightmare history, make sure to subscribe to Before Iron and hit that notification bell. We've got dozens more videos exploring the brutal realities of life before modern civilization. And trust me, Bronze Age medicine is just the beginning of the horrors our ancestors called everyday life. Next week, we're diving into more Bronze Age brutality, and I promise you, the medical procedures we discussed today will seem merciful by comparison. Until then, be grateful for anesthesia, antibiotics, and the fact that modern surgeons aren't working with bronze tools. Thanks for watching, and remember, history isn't just about dates and kings. It's about real people who endured unimaginable hardships so that we could eventually live in comfort. The least we can do is remember their suffering. Subscribe, like, and if you enjoyed the video, please do leave a comment. We'll see you next week for another journey from life before iron changed everything.